name is Dr. Johnson Mwangi. I work here at Tendercare Dental. I'm the lead dentist or the clinical director. I am a general dentist, but I have a postgraduate certification in dental implants from the University of Pretoria. And therefore, I do a lot of dental implants, but largely I also do a lot of cosmetic work, crown and bridge, root canals, and a bit of orthodontics as well as do the management in the practice. Well, Transafrica just popped up in the market like any other dental supplies company, but they came in with a bang. One, by the fact that they were backed by a clinician, a dental clinician, Dr. Joseph Gakonyo. And by that, it gave the company a lot of legitimacy by the fact that him as a clinician, the products that he introduces to other dentists, he's also using them himself. And of course, Dr. Gakonyo is a well-respected person, especially in dental implants, implantology in Kenya and even in the rest of the world. And therefore, for him being associated with Transafrica, that has really helped sell and kind of attract clinicians to the products that they sell. So I think almost as soon as Transafrica was established in 2016, we started purchasing products from them. I think we started off with other dental supply things, a bit of equipment from them, hand pieces, light cure units, high-end products that they actually stock. That was one of the reasons why we really stuck with them, because most of their products are very high-end, largely from Europe. And of course, in the process, they've also introduced a very good dental implant, Neodent, which is also a very high-end product and also, but quite affordable. I have been doing dental implants now from around 2014, so that's like about 12 years or so. And I started off with Ankylos, and we had to order it from South Africa. We had to send the lab to South Africa, and therefore it was a bit difficult sending work with DHL and that kind of thing, and with the lab, not much support from the lab, and therefore that was not user-friendly. Of course, the implant was very expensive. Then from there we moved on to Megagen. I think it was a Korean implant. It was quite good, but at some point again, there was a bit of a gap as far as getting supplies is concerned. You want this, you don't get it, or something like that. I think there was a challenge with distributorship. Then until we found out that Transafrica was dealing with Neodent, and they had fairly good training. I think that was a key thing. Not only did they introduce the implant into the country, but they first did quite a lot of training for the dentists. I think they brought in staff from outside, and of course Dr. Gakonyo himself has been doing training for the other dentists who are doing implants, and I think that has really helped a lot. So I switched to Neodent probably 2 or 3 years ago, and I would say the journey has been good because of reliability. If I need an dental implant, I can get it. I can just make a call, and within half an hour to an hour, I can get that product in the office. If I need to exchange an implant, if I bought quite a number of implants and I need to exchange one, they don't insist that I buy a new one. They can always take the one I am not using and give me the right implant that I need to use. I think that has really been very, very helpful. And of course, by the fact that they're also working very closely with the lab. Okay, the labs that are handling the dental implant work. I think that also helped. So there is that good connectivity or working relationship between the distributor, Transafrica, the clinician, let's say here at Tendercare, and of course the several labs that deal with that. So we are kind of like working as a team in all those 3 units, and I think that has helped. Of course, the support of Dr. Kakonyo has been very invaluable by the fact that when we have a complex cases, he understands the implant very well, and he's able to guide and also help. And I think Dr. Kakonyo and Dr. Karia has been very, very instrumental in helping the dental fraternity here in Kenya, and Tendercare included, to getting solid training and doing a thorough and predictable dental implant work. And I think we can only take it to the next level. So I really thank Transafrica for that consistency, especially of getting us the products when we need them and at the right time. You know, basically, for you to get, these days, to get a good product, normally you need a distributor in the country. Most manufacturers deal with distributors. So sometimes it is not very possible for you to buy directly from the source. And as such, if you have to really buy from the source, then you may have to buy relatively cheaper quality products. So if you have to use a high-end product like Neodent and some of the dental supplies that Transafrica or are there in the market, then you need to go through a trusted distributor or supplier. And I think that's where Transafrica comes in, by the fact that they've established themselves as a trusted and a trustworthy partner in this. So then I don't have to worry to try and go and bring stuff and try to import. No, I think all that headache, they take it off me. All I need to do is see my patients and use the right products, and then allow the patient to pay for that particular product. Of course, it is important to note that importing products in the country, in Kenya, has become very difficult because of unpredictable taxations and that kind of thing. And therefore, for me as a clinician, I need to remove that headache from myself. And that headache, Transafrica needs to take that. They import, and I do the work, and we are all happy. They are happy, I'm happy, my patient is happy. And I think that's how medical practice, dental practice should be. South Africa they are very flexible. They are not rigid, and they will deal with each case as it comes. They don't just say this is our policy, and so it's for if we have a problem with a particular product, they are willing to go the whole way and know why didn't it work well or something like that. And therefore, I see Transafrica growing even further, and I'm looking forward to working with the company, even as they introduce newer products, because I think they're introducing more and more products, range of products from different trusted manufacturers in the world, from Europe especially. So I see our relationship with Transafrica growing even further. And I would really wish them well, so that they can actually be able to support all the dentists in the country, and even in the region in East and Central Africa. Yeah.